All right, so we're going to dig in a little deeper to some of the major medical news and developments when it comes to the coronavirus. We want to bring in Dr. Neeta Ogden. Thank you so much for joining us, Doctor. So over the past week or so, we have been talking about some of these states that are really spiking. They do not want to become the next New York. They do not want to become the next epicenters. But, you know, some states like Texas and Florida certainly look like they're barreling in that direction. What can they do now to avoid becoming another epicenter?
You know, I think it's really scary what we're seeing. And in some ways, the only thing left to do at this point is similar to what New York did in early March, which was to create a lockdown situation again. And unfortunately, we're hearing from leaders in these states that that's absolutely not something that they're thinking about. That would require closing schools and closing businesses again. We're at a place in Florida and Texas where simple things that we wanted to start using to control the virus, like contact tracing and isolation, are no longer possible because it is so explosively large in how many people it has affected. So in my mind, one of the only things that we can start doing to control the virus is, again, creating the message over and over again that people should be wearing masks. They should be avoiding crowded indoor spaces. There should be social distancing. But with the numbers that we're seeing now that so closely approach what we saw in New York, I really think one of the only things that can happen at this point in the next few weeks is if they really roll back the public presence so that we can contain the spread of the virus.
So listen, it seems like weekly we hear more information about the virus, greater understanding, another study. Sometimes it's hard to determine just whether or not these studies have any value. So I'm going to, throw one at you. It's a study out of Spain that finds that antibodies can disappear in patients after a few weeks. There are a number of different antibody tests that are available on the market. People are taking them. They're assuming that, if they antibodies are found, it means that at some point along the line they were exposed to the virus and they've come out the other end and they're going to be okay. They have some measure of protection. How much weight do you put on this study? What are we to make of the outcome?
So, Anne-Marie, I think it's an interesting study for a few reasons. Number one, it looked at about 70,000 people in Spain, which we know was hit hard by the virus, about 250,000 cases, 30,000 deaths. And they found that about 5% of the population was affected. 14% of these people actually showed that their antibody levels, they were tested twice, receded. They decreased over time. So there wasn't this long-lasting immunity. But keep in mind, those are people who had asymptomatic coronavirus when they were tested. So they didn't have a strong element of disease. We do know that people who are strongly affected by coronavirus have higher levels of antibodies. What does this study mean? Number one, people who've been thinking that herd immunity is a way to control the pandemic, well, we're seeing that that's a fallacy. We need about 50 to 90% of the population, Johns Hopkins University says 70%, to be immune to achieve herd immunity. We're not reaching that level by the natural immunity of coronavirus. It also says that the natural immunity that comes from coronavirus may not be long lasting. So this can actually be helpful in terms of a vaccine. What vaccines are now doing is looking at antibody levels and trying to achieve levels of like 3 times above what people might from natural immunity so that we can see a more long lasting effect. So those are 2 really big takeaway points from this study.
Okay, that's interesting. We're also getting news that the federal government is throwing a bunch of money at a company, Novavax, $1.6 billion in order to get that company rolling on a vaccine, to develop a vaccine. It is perhaps the biggest deal so far under the administration's Operation Warp Speed. We have heard consistently from Dr. Fauci and others that, the end of the year is ambitious, probably the beginning of next year for some sort of workable vaccine. But, often when these experts talk, their words are really couched. There's a lot of like, hopefully, da-da-da-da. So I want to get from you, what is a workable timeline, do you think, for a vaccine that can then be distributed widely?
I think it's difficult to say. There isn't that much transparency about what these vaccines, where they are in their studies. They aren't releasing much data. We just keep getting these news stories that they're receiving money from the federal government. And yes, the Novavax vaccine is one of the biggest ones to date. It actually speaks to diversification of the federal vaccine portfolio. So far, we've heard a lot about RNA vaccines. Well, this is a protein-based vaccine. It's taking microscopic coronavirus particles and injecting them and using them to elicit an immune response. At this point, all of these vaccines are on this kind of trajectory. They've received money from the federal government. Even before they start phase 3 trials, the vaccine production is beginning. So it's a bet. We unfortunately don't know, and that's why there's so much of this language of cautious optimism. We don't know if they will succeed through phase 3 trials, unfortunately. But if they are a home run and they do win, we're poised to, get going out of the gate, which would, like they said, 100 million vaccines doses available for 50 million people would be able to get one vaccine dose and a booster by early 2021. So I think, unfortunately, in all of the talk about vaccines, we just have no certainty, and it always remains one of cautious optimism.
Yeah, and when I hear about that, I think what we sort of never really factor in is just how comfortable the general public will be with taking a vaccine like this. There's been a ton of misinformation out there about the virus, about treatments. And quite frankly, there's misinformation, but then there are also competing studies. We saw this study about the anti-malaria drug that the Trump campaign has been touting, saying that, look, there's a new study indicating that it in fact is advantageous to take this anti-malaria drug. But we've seen many, many studies that show the opposite. I think it's very difficult for the layperson to understand who they should trust. And then when we hear about this accelerated pace for a vaccine, I think it makes people pretty uncomfortable as well.
No, I think you're totally right. And I think, it's unfortunate that this coronavirus is something so entirely new. Studies and medical science information that was not peer reviewed was coming out right and left. And you're right, the lay population doesn't necessarily know how to interpret that the way even scientists would. There's been a big move now to only allow peer reviewed information to be disseminated to the public. I think the most important thing here is we're pouring billions of dollars into vaccine development. We need to allocate some of that $10 billion of federal money into public education, because we are hearing that people will be reluctant to take a vaccine. It's easy for a doctor or a scientist to sort of interpret data and then feel confident about taking a vaccine. But for most people, they need greater information, reassurance, and it needs to be on a community level, almost like how we're doing contact tracing, to really infiltrate our communities so that they can feel safe and that we can indeed achieve herd immunity from the vaccine. Because once a vaccine is available, if people aren't taking it, it really leaves us in this position where old people and students, a lot of people are still vulnerable. So one of the biggest elements here is going to be distilling that information about the vaccine, that it is safe, that it has gone through these many phases of trials and approval in order to get to a place that is safe for the public to take it.
Yeah, I think you're spot on there, Dr. Ogden. Thank you so much.
Thanks for having me.